You might hear the tea boiling in the background, the water boiling in the background. Okay, everybody's got their own sources of information. I like to find these types of articles and pieces of information that you can share with normies, people that are on the periphery, people that are completely opposed to us. So this is one of those times where I find this article. It's really good. It's written by Marty McCary, and you can get it on the Wall Street Journal. It's entitled "The High Cost of Disparaging Natural Immunity to COVID." It says vaccines were wasted on those who didn't need them, and people who pose no risk lost jobs. It's a really good article. Let's see here. Encourage you to find it. This is one of those ones that you want to send to people. It says public health officials ruined many lives by insisting that workers with natural immunity to COVID be fired if they weren't fully vaccinated. But after 2 years of accruing data, the superiority of natural immunity over vaccinated immunity is clear. The superiority of natural immunity over vaccinated immunity is clear. By firing staff with natural immunity, employers got rid of those least likely to infect others. It's time to reinstate those employees with an apology. For most of last year, many of us called for the Centers of Disease Control and Prevention to release its data on reinfection rates, but the agency refused. Finally, last week, the CDC released data from New York and California, which demonstrated natural immunity was 2.8 times as effective in preventing hospitalization and 3.3 to 4.7 times as effective in preventing COVID infection compared with vaccination. Yet the CDC spun the report to fit its narrative, bannering the conclusion, and this is the quote, "Vaccination remains the safest strategy." Wow. What does it do to the credibility? It's like they think they can get away with it. Remember when you were a child and you thought that you could lie to your mother or your father, and as long as you got away with it, everything was okay? That's why at a very young age I started telling my son the story of the boy who cried wolf. Not to scare him, but to let him know that his word is very important. And so this new style of journalism that we're finding from people like Joe Rogan, people like Lex Fridman, where it's not gotcha, it's not try to slant, try to literally change the conclusion. That's why so many people are listening to these other forms of media, because it elucidates you more. If you don't want to be tricked, if you want to gain more information, if you're truly curious, if you're truly seeking the right information, I just don't understand why they even think this is an effective strategy. Okay, so the CDC spun it as vaccination remains the safest strategy. It based this conclusion on the finding that hybrid immunity, the combination of prior infection and vaccination, was associated with slightly lower risk of testing positive for COVID. Remember when Dr. Sanjay Gupta from CNN was on Joe Rogan's podcast, and he was trying to encourage Joe Rogan to get the vaccine, in addition to the fact that Joe Rogan already had natural immunity, and Joe Rogan politely was kind of laughing at him. Okay, so they're saying that slightly was associated with slightly lower risk of testing positive for COVID, hybrid immunity. But those with hybrid immunity had a smaller, or wait. Those with hybrid immunity had a similar low rate of hospitalization, 3 per 10,000, to those with natural immunity alone. In other words, vaccinating people who had already had COVID did not significantly reduce the risk of hospitalization. So vaccinating people who had already had COVID didn't significantly reduce the risk of hospitalization. Similarly, the NIH repeatedly has dismissed natural immunity by arguing that its duration is unknown, then failing to conduct studies to answer the question. Because of the NIH's inaction, my Johns Hopkins colleagues and I conducted this study. We found that among 295 unvaccinated people who previously had COVID, antibodies were present in 99% of them up to nearly 2 years after infection. We also found that natural immunity developed from prior variants reduced the risk of infection with the Omicron variant. Meanwhile, the effectiveness of the 2-dose Moderna vaccine against infection, not severe disease, declines to 61% against data and 16% against Omicron at 6 months. According to a recent Kaiser, that was a Kaiser study. Let's see, and it says something about Pfizer's COVID vaccines. They've been less effective than Moderna's. Wow. I know some people that got the Pfizer. The CDC study and ours confirms that that more than 100 other studies on natural immunities have found. Okay, so their study, the CDC study, it confirms what at least one other studies have found. And it says the immune system works. The largest of these studies from Israel found that natural immunity was 27 times as effective as vaccinated immunity in preventing symptomatic illness. And it says, none of this should surprise us. For years, studies have shown that infection with the other coronaviruses that cause severe illness, SARS and MERS, confers lasting immunity. In a study published in May of 2020, COVID recovered monkeys that were re-challenged with the virus didn't get sick. So, it says public officials have a lot of explaining to do. They used the wrong starting hypothesis, ignored contrary preliminary data, and dug in as more evidence emerged that called their position into question. Many, including Rochelle Walensky, now the CDC's director, signed the John Snow Memorandum in October 2020, which declared that, quote, there is no evidence for lasting protective immunity to SARS-CoV-2 from SARS-CoV-2 following natural infection. Again, that quote was, she signed this document, it's called the John Snow Memorandum. She's the CDC director. In October 2020, she signed this, and it says, there is no evidence for lasting protective immunity to SARS-CoV-2 following natural infection. It's like, it's not even saying there's competing evidence or we should just play it safe. It says there's no evidence. Do you see how they are? Do you see? Goes on for many, many more paragraphs. I'm telling you, this is one of those ones. Let's see, a few more paragraphs that you have to. I saved these. It says many clinicians who talk to other physicians nationwide have long observed. We don't see reinfected patients end up in ventilators or die from COVID, with rare exceptions who almost always have immune disorders. And then they said, meanwhile, public health officials recklessly destroyed the careers of everyday Americans relying to fire pilots, truck drivers, and others in the supply chain workforce who didn't get vaccinated. And in the early months of the vaccine rollout, when supplies were limited, we could have saved many more lives by giving priority to those who didn't have recorded natural immunity. I want to see if there's any more. It's so bad that the hospital summoned staff who were COVID positive to return to work, even if they were sick, according to an internal memo obtained by Jason Rant of KTTH Radio. The memo stated that, quote, positive staff with mild to moderate illness could work so long as they wear appropriate personal protective equipment, don't take breaks with others, and agree to stay home if symptoms worsen. So they told people that were unvaccinated, people that had natural immunity, they couldn't work and they lost their job, but they allowed people who were positive for COVID to come to work. That's cult-like delusional behavior. What do they call that? Mass psychosis thing? The Centers for Medicare and Medicaid Services took the hospital mandate national by decreeing that all medical facilities under its jurisdiction require vaccination for employees, including those with natural immunity. The Supreme Court upheld the rule on January 13th, the same day it issued a stay against a similar mandate from OSHA. Connecticut has suspended its vaccine mandate for state employees, and Starbucks is rehiring employees fired for being unvaccinated. Other states and businesses should follow their lead. Politicians and public health officials owe an apology to Americans who lost their jobs on the false premises that only unvaccinated people could spread the virus, and only vaccination could prevent its spread. Okay, so on the false premises, I want to repeat that part. This is what they were putting this out there, that only vaccinated people could spread the virus, and only vaccination could prevent it. Remember, they were calling it a pandemic of the unvaccinated. Soldiers who have been dishonorably discharged should be restored their rank. Teachers, first responders, and others who have been denied their livelihood should be reinstated. Everyone is essential. You know that saying, when you're a hammer, every problem looks like a nail? Sometimes we repeat these sayings, but we don't really think about how they apply. One of the issues with the left wing is that control and gaining power is the solution to everything for them. So that's all they've been doing the entire time. Whenever there's any options of what we should we do it like Sweden, or should we do it like Australia? They're like, oh, I mean, Australia, we should do it a little worse than Australia. They're nuts. I want to see them have an actual debate with somebody. I want to see AOC have a debate with Ben Shapiro. Jeez, these people. Okay, again, this is on the Wall Street Journal, the high cost of disparaging natural immunity to COVID.